All right, good morning, everyone. Thank you for joining us for this second meeting, this legislatively funded family child care pre-licensing grant update here in December, right around the holiday season. We thank you for those of you that were able to join us, and for those that are viewing this recording, we also appreciate your time and your partnership as well. My name is Daniel Bates. I'm the statewide family child care project manager. And we also have Vicki Ainsley with us, who's going to be sharing a lot of information about this family child care pre-licensing grant. Um, Also with us is Kelly Shaw. She's our business anchor for the Family Child Care Project. April McLean, who is our family child care professional development anchor, and Lori Jones-Ruff from Southwestern Child Development Commission, our interim executive director. She's also with us this morning. And many of you, stakeholders, partners, again, we appreciate your support and you being here this morning. April, if you'll advance over to the next slide, please. So before I toss it over to April, I thought it would be really good to share just a brief update on some activities with the statewide family child care project. Some of the activities that we already had embedded even before this grant, it really just kind of worked hand in hand and weaved in together. One of the things that the Family Child Care Project is doing is that we are getting some information about the approved curriculum from DCDEE, well, the curriculums that are approved, might I add, for family child care. And these come from Teaching Strategies and Gee Whiz. And many of you know that Teaching Strategies has the creative curriculum. Well, there's a creative curriculum for family child care. So in the month of December, Teaching Strategies came to our regularly monthly meeting for the family child care consultants for the project, and gave some information about the creative curriculum for family child care. Coming up at the beginning of 2025, the group Gee Whiz will be meeting with us at our project meeting to share about the approved curriculum for family child care that they offer. And it's very interesting, very different, but this not only helped bring some awareness for us, but we often hear from family child care programs that they're interested in having some type of curriculum. So we definitely want to make sure that we have that knowledge where we can make sure that we practice what we preach and that we are doing our part as a resource center for. Also with the project, NCR Lab recently came to our Family Child Care Project retreat, which was last month. They gave some information about the upcoming FICRS 3, some differences between the FICRS R and the FICRS 3. The project will be going through ERC training. So that will be starting at the beginning of 2025. And RLAP, who has been fantastic, we definitely appreciate their partnership. They're going to provide additional training because, as we know, ERC, there's the ERC training, but then RLAP is embedding the North Carolina content and what we practice here in the state. So they'll be meeting with us after we finish the training for questions, for some clarifications, reiterations on what's going on in North Carolina. Something that some of the regional family child care consultants have already started is creating a regional family child care support team in their area. So what might that look like? You'll be seeing more of those opportunities throughout the state in 2025. So those regional teams or the components of those include leadership in family child care programs, the operators, those that support family child care. So it could be the technical assistance providers. It could be uh, DCDE licensing consultants, childcare health coaches, business partnerships. This is an opportunity for folks to get together, come to the table, and be supportive and be able to network together across the state. So if you're curious on who your family child care consultant is at your CCR&R, you can go to the website here posted at www.ncfamilychildcare.org, click on services, and then find a regional family child care consultant. And you can see a map there where you can click on one of the 14 lead CCR&R regions. And lastly, I wanted to share with you is that we have an anticipation of a new family child care peer mentorship program later this winter. The program now is going quite well, and it is a very good group of people, and they are very supportive. And the most recent meeting, even the mentors have said that this has been a very enlightening experience for them. So they've created support, they've created systems, they've created a way to even figure out what can they do if they're in the same area and they needed someone to come in and fill in as a sub. So they're really working together, and it is so far it has been a great experience. So we look forward to those that are recipients of the pre-licensing grants to be able to join this peer mentorship program in 2025. So with that being said, Vicki, I'm going to toss it over to you.
Thank you, Daniel, and feel advanced, April. Thank you. Some of this I've already talked about a little bit in the first meeting, but I just thought just to get a good background as we start with this meeting is to remind everyone that we started out with 31 prospective family child care operators that were identified, and they were identified by our outreach to the DCDE lead licensing consultants, and that began in early September. All the people that they referred to us had attended a pre-licensing workshop. All of them had actually met with, reached out to their DCDE consultant to complete an application for licensure and to begin their process. So that's the number that we began with in September. April, go ahead. Some of the facts about those 31 recommendations is that we had referrals from 12 different consultants. They represented 20 different counties and 11 of our 14 CCR&R regions. And 3 of those potential operators indicated that they were Spanish speaking. So the next big step that we did was we worked with Duke University's Center for Child and Family Policy and worked on a pre-survey. They're going to do a pre-survey. They did a pre-survey with all of those 31 individuals, and they plan to do a post-survey. So in September, we emailed out the survey to the potential providers. The survey was offered with a Spanish translation option also. And again, on October 25th, we sent those surveys out again to prospective operators, to those who had not responded. And when the operators completed the surveys, those results went directly to Duke's Child and Family Policy Center. So we have not seen any of those results yet, but we'll talk a little bit more about what's going to happen with those results soon. So they have been notifying us as those surveys were completed. And then after the surveys were completed, then the potential operators were sent an email with a link to a Google folder that included their grant application, their grant budget, and instructions about how to complete the materials. The family child care consultant was also sent an email at the same time with a link to that folder and a way to connect with that potential operator. So they began reaching out at that point to the potential providers and offering assistance to help them complete their application and their budget. Then we had a few little snags. One kind of really huge snag was that the hurricane hit Western North Carolina on September 27th, and this slowed down the responses from some of the providers. And then also our agency generally and myself are sitting in the middle of the hardest hit part of areas. And I was without power for a few days and water for a long time. A couple of our potential providers had to be found, as we said, because we had no way to contact other people. They had no way to contact other people, and so we weren't sure everybody got the actual emails, or if they tried to send their survey, if their survey got messed up in things that happened when the internet went down. And then also our potential Spanish speaking applicants didn't respond. So Duke assisted us by having a person that's fluent in Spanish try to contact those individuals. And that was a little bit more challenging than we thought as well. Although she called the people, and most of the time they didn't answer. She left messages in Spanish, and she finally had one person respond to her and complete the survey. Go ahead. So here's the responses to the survey. We had 3 of the potential providers that didn't complete the survey, despite our trying to reach out numerous times, emailing, calling, and as I said, Duke's person tried to call the potential Spanish speakers. We had one person who was in the hurricane area that didn't complete the survey because she had to relocate to a place that didn't allow a family childcare business. I did reach out to her, talk to her personally. She really wanted to open a family childcare home, but couldn't in the place that she had to relocate to. So she did not complete the survey because she didn't think there was a need. So we had 27 potential grant applicants complete the survey. 2 of those that have completed the survey haven't actually submitted grant applications, and they haven't responded to numerous attempts to reach out to them. I've tried to reach out to them, as well as their consultant in their region has tried to reach out numerous times, and with no responses. So some of our preliminary results so far about the applications that we have received. Kelly, who's on this call, and I went through the applications and studied them very carefully, tried to get some information from them and find out what else we might need. So we have 24 total applications. They represent 16 counties, as you can see there, all across the state. They also represent 10 of our child care resource and referral regions. We have one application that is still in process, and then we have 2 additional applicants that we're still trying to contact just to be sure to give them another chance to send their application in. We had one person who actually submitted her application and then withdrew her application. She had another job, and she decided after, going through all the licensing stuff that she wasn't sure that that's what she wanted to do. So she withdrew her application for a grant. You can go ahead. So some of the facts that we have about the applications we've received, there is one male provider, and 7 are in counties that are rated a 1 on the county distress scale. And by using the zip code, 4 are in the most distressed areas of the state, and 6 of them are in the at-risk areas of the state. More of them are located in the child care desert areas than are not. And I hope I've got that correct. Well, I know that Duke is going to do more intense looking at that as far as who is in the child care desert areas in the state, but using what limited knowledge I had of how to use their tool, this is what I found out. So when we started working with them, they were in the pre-licensing process, but 8 of those have already achieved a temporary license, and that's fine, that's good. And we hope more are close to receiving a temporary license. And actually, before we actually finish and give out the grant funds, we're going to contact again the lead licensing consultants and find out where that people are in their process of achieving a license to make sure that they don't know that somebody has withdrawn. We have 14 that have indicated that they plan to or are already serving infants, and 5 additional applicants have indicated that they plan to or are serving toddlers. And that's part of our grant um, specifications, that we need to create new infant and toddler slots. So we feel confident that we are going to do that. So I just want to give you an idea of the kinds of things that they requested on their budgets. And we do have, some parameters of what we will accept or let them request. Number one, we do want them to get an approved curriculum. We want them to choose one of the 2 that's been approved by the division. Um, lots of people need mulch, as you can imagine. Some people need fences or fence upgrades, because some local zoning areas do require that. Um, Lots of other things, child size furniture, all the things we would expect, like books and puzzles and games and art materials, some outdoor equipment. Uh, we also have requests for laptops or computers. We have some requests for tablets. We're we will let them get something that's for technologically, that's for their business side of the home, or their facility. But we are not into approving tablets for the use by children. That's just not, that's not really appropriate, and we're not going to fund that through the grant funds. You can go ahead, April. So some of our next steps, we have reviewed extensively the applications, the budgets, and we had a few questions. We had some things that we had to go back and say, for instance, tablets. We're not going to allow a couple of tablets or 3 tablets in your child care home. And so the applicants and the consultants have been notified about additional information we might need. Some applications may have a few boxes that weren't checked. We had to, find out where are they in the process? Have they had their water tested and those kind of things? And then also to let them know that certain things might not be approved on their budget, or we wanted them to look at ordering something instead of from Amazon, ordering it from an office supply place or something, so that we know that they're maybe better quality items. So we have calculated the request for funding at this point, and all of the ones that we have the applications from, 23, because we still got one that's being worked on. All those have been reviewed and they can be funded. And so our goal was 18. So even in this one round of grants, we're going to meet our goal of funding or helping 18 and more programs get open. There is a little cushion there. So if we have the one that's being worked on and the 2 that we're still trying to get in touch with and give them an opportunity, we will be able to probably help them as well. So it may end up being more than the 23 that we have identified that are able to get funding to help them open up and get started. So our consultants are hard at work. It's a great group of people, and I don't think any of the lead agencies are on there now, but we have some fabulous consultants who are very eager and willing to help the applicants as they have done their applications and their budgets. And they're working with them to get any additional information that we need for their applications. And as I said before, I'm going to contact all of the DCDE consultants to be sure that the applicants are still in the process and still potentially viable to be able to get a license. You can go ahead, April. Thank you. We will submit our first written report to the Division of Child Development and to the legislature on January 3rd. In the new year, we will start distributing the grant funds, and the consultants will work with the applicants to order the approved items. They already have a really great process with the applicants. They, help them get things already possibly in a cart, like with Kaplan, or some of the other places, so that when their grant funds come, they just have to hit send and order their items. They will start working with them to help them once they get their temporary, start working toward a higher star rating, start working with them, helping them see what they need to do to have quality environments and a quality program. As Daniel mentioned, then these new grantees will also be paired with a mentor, and that's going to be really, really helpful for them. As he said, the mentoring program is going really well, so I think it will be great for them to connect with someone who's already in the business and knows what they're doing. They're also going to be connected to business training and supports. The consultants will do some of that, as well as they've been trained in some business things, and well as April, who is with us, has our PD coordinator, will be helping with that as well. And as part of this project, our consultants are receiving personal translation devices, which is going to help as we work with, as they go out and try to potentially locate some family child care providers who don't speak English. So these are the things that we're going to concentrate on first thing after the holidays, when everybody gets back in place and starts working again. So what our future holds, what we think is going to be going, these are the things that will be happening in the future. Ongoing technical assistance with the consultants. They've already put a lot of time in with these applicants, and some of that information will be in our report that comes out in January. They will keep on working with them in the new year. Our business professional development, curriculum training, mentoring, and then there will be post surveys to all who completed the initial survey. Lots of data collection from our consultants, data collection from us in the project as we are working with these applicants, and looking at their grants, their budgets, and things they purchase, all those kinds of things. We'll be reconciling the grant expenditures and lots more, as all of you know, the things that have to go, that have to be done when you give out grants and when you have objectives to meet. And we are trying to tick off all of those things that we need to do with each applicant, and hope that we can get them started on a good start as a new licensed family child care business. I know that at least one of the ones who already has a license is licensed as a center in a residence, which I know at least one. We may have more than one, Kelly, I'm not sure, but I know we have one that is. So that's really good. And does anybody have any questions? I know most everybody's muted and everything, but or Daniel or Kelly or April, do you have anything, Lori, that you would like to add? And then anybody who else is on the call that has questions for me or Daniel or any of us in the project, just let us know.
Hey, Vicky, there is something I do, excuse me, I do want to add real quick, because Dr. Mary Alvera is here with us, and I just want to give a shout out to her and Cindy Osborne for also coming to the retreat and sharing with the project about the community college system, understanding the early childhood coursework, especially for family childcare operators, and kind of looking ahead with that, plus sharing about the Small Business Center. So definitely want to give thanks on her or to her and for Cindy Osborne as well from Stanley Community College for taking their time out to educate the project and share a little bit more information, because that's a lot of family childcare operators, if they either they enjoy the path of education or they're not really sure um, on where to go or how to get started. So we had a lot of good feedback from that as well.
I agree, Daniel, and I want to say thank you to Mary too, because I learned a lot that day, and I just retired from the community college, but in the 2 years that I've been gone, there's been a lot that has been going on around early childhood, and I'm in the community college, and I'm just thankful that they are responding to the needs that we know is out there right now, that the things that we know need to be out there. And um, the small business centers, every community college has one. So they're right there for the family child care providers if we can get them connected to them as well.
And to add to that, they also offer a lot of virtual options. So if there's something that you're interested in and maybe it's not in your county or your region, there are spots available that you can do from home, or, that at a more convenient time, especially when you're running a family childcare business. I also wanted to add, we still have a few vacant regions. And so I also want to extend thanks to the CCR directors in those regions who are assisting us and also helping support through um, these grants in areas, if that's with themselves or with additional staff. I know Denise is on here as well, because she and Cindy and Vicky have been assisting conversations with those directors, and we would not be able to do this without all of those extra outside supports.
Very true. Anyone have any questions for us, or any comments, or any suggestions? We really are open for suggestions and would love to hear them.
Or maybe there's something that's going on in your neck of the woods or in your expertise that you're finding that is supportive of family childcare, or maybe even something that might need to be addressed.
I would love to say that this is great and so amazing from the first time that I really heard about the work that you all were doing. And I was also at the CCHC conference, just so excited to see this focus with grants on our family childcare across the state. And so for me, I'm the early care and education manager at NCPC. For those of you who don't know, just thinking about a lot of our partnerships, of course, our partnerships are lead agencies, but a lot of our partnerships, or let's say some, not a lot, don't fund CCR&R. And so what we're always looking to do for those partnerships is to really think of ways that they could fund, grants such as this through their Smart Start funding. And so I think I checked in with you a couple times, Daniel, but just really thinking about as we move forward, certainly not in this call today, of really thinking about how to, be collaborative and partner across the state to continue to, uplift the great work that you all are doing. And then other ways we can, partner together to provide funding for family, childcare that's not necessarily coming from this particular pot of money. So just want to say kudos to you all for the amazing work that you always do, but especially around this area. I just appreciate you all so much, and looking forward to ways that we can really think about how others across the state can, kind of learn from what you're doing around these grants. So really excited for the data and the research as well. So just wanted to say kudos, thank you, and just so open and looking forward to how to provide these opportunities to other family child care homes across the state, following sort of the model that you all have established. So thank you.
Thank you. You know, Angela, as I've been working on this, 23, 24 new providers is fabulous, but it's a drop in the bucket to what we need. And you know, that's not very many across the state. And we were only funded to do 18. And if we end up with 24, that's great. That's more than what we had to have. But I've just been thinking there's got to be some other private dollars or something out there that people can work together and pull in to try, especially to get some more homes in those areas that are the childcare desert areas. I mean, we really need it. And, you know, it just broke my heart that the one here in Buncombe didn't get to open up because of where she moved to. And that she was renting, and so the landlord wouldn't allow it, you know. And of course, that first couple of weeks after the hurricane, you know, I mean, even I, who did not have any damage or anything like that, my mind was just scrambled. So I can imagine a person who was relocated, what she didn't know what to do. So I mean, I know there's got to be some other way to fund some more of this kind of work. So I appreciate what you said. It's great.
Thank you.
Daniel, I would just like to make one comment. I actually was looking at the preliminary report that Duke will be presenting to DCDEE and the legislators in January. And a couple of weeks ago, I was looking at a national uh, report around education of family child care operators, and I was curious if North Carolina was kind of along that same level of education at the national level. And that information will be contained in that report. And it was very validating to me to see that these truly are early education professionals that are wanting to do this work in a small home environment. And so I think that's something that we need to make sure that we continue to share with people, that these are professionals and that they are doing this work in the way that they want to do the work in a small home environment, but it does not detract or take away in any way what's happening in that environment as opposed to a center-based environment. So I just wanted to share that.
Yeah, thanks, Lori, because I like Lori and Daniel, we've also reviewed the report, and I didn't want to say too much about what's in the report, but thanks for pointing that out. Daniel, I'm sorry, I must have interrupted you. Sorry.
No, you're good, and I couldn't agree more. And it kind of even goes back to even whenever there was a lot of PDG activities going on, and being a part of those and being a part of additional panels and the conversation with education, and there was, for those of us that have provided technical assistance over the years, like been boots on the ground. I mean, there has always been interest in education, but they just didn't know where to go, or those that found out, you know, it's like they were over here, here's those that didn't. But even in those PDG activities and whatnot, and being in those panels and whatnot, it was kind of the similar thing. Like, yeah, there's a lot that are wanting to be educated or are in education, and then there's just those that like, okay, well, where do I go? I don't know where to start, or I didn't even know that there was an opportunity for me. So it really brings up that point of, okay, how can we get that awareness about? So yeah, it's quite interesting for sure.
Everybody, this is Tammy Barnes. I just wanted to kind of piggyback on what Angela said and just thank you guys, Daniel and Vicki and all of your team for this work. It's so very important. And, you know, we've seen our family childcare homes go down for many years, and they've just, you know, they've felt like they weren't important. And this project is really building morale across the state and helping these people understand how important they are. So kudos to all the work you've done, and DCDEE looks forward to working with you in the future. Thank you.
Yeah, thanks, Tammy, and thanks for all the support and all the help from your consultants. Definitely very good. And thanks, April, for putting our next slide up, that we do have dates for the next stakeholders meetings already set. So if you'll put those on your calendar, that will be great. Or let us know if you have a huge conflict, or you know what we can do. But that's the dates we have planned at this time. So appreciate it.
And we will also send a flyer out just as a reminder too. But you know, since we'll wait until the new year, because we know a lot of people are getting ready to take a break, and everyone's emails will probably be flooded upon returning. So we will send that out here at the beginning of the new year as a friendly reminder. So that's April 4th and then June 30th.
June 30th. Thanks to everybody, all the support, all the help, all the suggestions, all the ideas. I really appreciate it. We all do. And I had to say thank you to Daniel and Kelly and April for all that they have helped me with through this process.
Yeah, and we greatly appreciate it, Vicki, and everybody here for really every single person that is here today has helped in some way, somehow with this project, with family childcare, with both. And this just proves it does take a team to make things happen. So I can't thank you enough. So we greatly appreciate that.
Yes. Thank you, everybody. And I hope everybody has a great holidays. Happy holidays. So
Happy
go enjoy your
holidays.
time off. Sorry.
No, thank you. Thank you. Happy holidays, everyone. Thank you again for the update.
Thanks.